Maria Guadalupe Sostenes Galindo, and my team will present the procedure a blood test made of Frida Garcia Mendoza and Alexa Nay Carvajal Araujo. Welcome. Previous steps. Gather the necessary material. Syringe, hypodermic needle, or vacuum tube. And proceed to wash your hands, drying them with sanitizers, and identify and prepare the patient. Procedure. Number 1. The site is chosen, preferably in the antecubital region, and palpate to identify. 2. Tourniquet is applied 4 or 5 fingers above the chest side. And number 3, the patient is asked to clench their fists so that the pain is delayed. And 4, put on a pair of suitable non-sterile gloves. And number 5, the area is disinfected with isopropyl alcohol or ethanol 70 for 30 seconds and let it dry. Number 6, the vein is held by supporting the patient arm with your thumb under the venous puncture. Number 7, the needle is inserted into the vein at an angle of 30. Next, once the blood has been drawn, loosen the tourniquet before removing the needle. Number 9, the needle is removed and over a clean gauze or dry cotton ball to apply to the area. Next, the cincture is disposed and they use needle inside the sharps container. Next, mark the label and record the information in the formats. Objects are discarded that might leak blood or body fluids in the container for infectious material. And finality, remove your gloves and place them in the general waste container. Proceed to wash your hands. And blood extraction is realized common way and safe practice that can help diagnose or monitor many diseases. And universal precautions, all samples for diagnosis, confirmation, or research will be considered potentially infectious, so preventive measures relate to exposure to biological agents must always be followed, as well as the recommendations of the World Health Organizations, Laboratory Biosafety Manual, Geneva 105. A biologically adequate sample is defined as the representative sample of the site of the lesions in sufficient quantity placed in a clean container, properly identified, preserved, and transported.
Today we'll talk about the balloon sample test. Balloon sampling is used to assess overall health, diagnose diseases, evaluate organ functions, and monitor the effectiveness of treatments. The number and types of balloon cells, chemicals, proteins, and other balloon components are measured. Some recommendations before the test. Fasting balloon tests are required. Fasting, which means not eating or drinking anything except water for a specific period before the test. For example, you may need to fast for 8 hours. Medications, you may be instructed to stop taking certain medications before the test. About specific activities, it is recommended to avoid vigorous exercise, smoking, and alcohol before the test. Inform the laboratory staff of any medical conditions, allergies, or medications you are taking. Some recommendations after the test and diet. It's something after the test about fatigue, hydration, follow instruction. Follow any specific instruction provided by the laboratory staff. And about heavy activities, you may be advised not lift heavy objects or perform sensor physical activity for the short time after the test.
Side effects. The common side effects are dizziness or lightheadedness. This can occur due to blood loss and decreased blood flow. Pain or bruising at the puncture site. These usually go away within a few days. And bleeding. Some minor bleeding at the puncture site may occur, but it usually stops quickly. The more serious complications are fainting. In some cases can trigger a vasovagal reaction and cause fainting. Allergical reaction. An allergical reaction is occur the use of antiseptic solutions. Infection. There is a very small risk of infection at the puncture site. Nerve problem. Blood collection can damage a nerve, causing pain and numbness, and large bruise or excessive bleeding. Although less common, these cases may require medical attention.